Leadership is absolutely essential in any environment, in any industry, healthcare system or whatever. We have focused on that far too little in the past.
Organisations in the NHS have people who are clinically excellent, and they work alongside a number of managers who have been developed in various ways. What we are helping the clients to do is to bring those managers, those support service leaders together with clinical professionals and create a community of leaders within their own locality.
We wanted an organisation that firstly would sell us something that was tailored to our needs, but secondly that as those needs change, because the NHS is a fast-moving industry, we wanted something that would change with them.
The leadership programme on which is facilitated by the King's Fund has been an opportunity to be involved with looking at my own personal development, but also looking very specifically at leadership tools which then I can present and use within my own organisation.
It also gave us the opportunity to be able to learn about people's characteristics, people's preferences, how that can affect our day-to-day working life in terms of decision making.
It's really a focus on how do leaders develop the skills and capabilities to lead their teams in the provision of quality care. So it's bringing together leadership and quality services.
I was using very self-deprecating language and very sort of, not really want to say who I wanted to be, and I was told to embody what I wanted to be. And I've had the opportunity to undertake that and lead some change within my organisation.
And I know that I want to be a board member, and really the challenge and the support I've had from this group has enabled me to apply for another job, and I'm delighted to say that I've been successful with a Director of Nursing and Midwifery job.
The programme begins with a week where we take the participants away to some very nicely converted barns in Norfolk, where they're able to live together for a week.
They do some of that early group process stuff, so they have some of the fights, they have some of the challenges with each other in a safe environment.
I was really surprised to see, the activities that we were involved in, and it really brought everyone together, and I guess it stripped back our roles and we became the leaders that we were.
Quite a lot of the rest of the programme involves a mixture of us doing some more work with the participants around personal development, but also putting in some really tangible input, some skills inputs around different things like innovation, concepts of quality, how you lead people in organisations where you're trying to really focus in on quality.
The political module, fantastic exposure to practising what it would be like standing in front of a public meeting, meeting union representatives and talking through difficult issues.
The best thing about the programme is it's actually responded as things have changed. So we have looked at papers, we have looked at the white paper as it came out, we've looked at things as they've actually been evolving. We've had a lot of changes over this year within the NHS, and we've actually talked about them.
We keep going back to the workplace to try and exercise or use some of these tools that we have learned. And that has been I'll have to say it has been a great experience for me. It has helped me in terms of moving things forward.
When we had a particular challenge in the middle of the programme, we were able to design a completely new programme for our PCT chief execs, which was designed incredibly quickly and delivered at speed and precisely what we wanted. Again, not an off-the-shelf package.
We don't stand alone as a leadership development organisation, that we work very strongly with other parts of the King's Fund, most noticeably our policy team, who are constantly working with developing and commenting on local and national policy.
It's clarified what I do well, what I find challenging, and given me lots of tools to manage the times when you find yourself reacting in a way that you recognise it really quickly, and you've got almost like a toolkit that you can get something out quickly and think, right, okay, let's reframe that.
I get to understand where people are coming from a little bit more. Because, when you deal with quite a number of organizations, everybody have got their own agenda. You have to find a way to understand what's the agenda, how does that impact on our own agenda.
Most clients that we work with recognise that the need to build talent within their own organisation is how they will deliver the changes needed for the NHS, for the patients, and for the very demanding agenda we have coming next.
We need the very best leaders, and the very best leaders will only become the very best with support and development.